What's up, everybody? Welcome to the Kairos Pacific University Podcast, the show that gives you so many things about social life, about health, about mental health, wellness, all these incredible things, business as well, and all of these wonderful topics that influence us on a daily basis. And of course, the university that is incredibly affordable and incredibly wonderful and very Christ-centered. Hi, my friends. Today I have an incredible guest with me, and he is just a ball of energy. From the moment I met him, I'm really excited for this. And he has a wealth of knowledge, and it's Dr. Neil Patel. Dr. Patel, how are you doing today?
I'm doing great. Thank you for having me. I'm doing really well. How's everything?
Good. I'm so excited to have you. One of the topics that you had mentioned is lifestyle changes, and I'm like, what can I do? But before I ask you these questions, I want to hear a little bit about yourself, about your clinic, about your practice. What do you do? Tell us a
Yeah,
little bit.
sure. So my name is Neil Patel. I have a private practice here in Orange County, California. I mainly see adult patients, but my main focus is actually on the geriatrics, which is considered 65 and older. So a lot of my patients, they come with a lot of, medical problems, chronic conditions. Obviously, they are on meds. My personal philosophy in medicine is fewer pills, fewer doctors, fewer procedures, the better. So I'm always trying to work with my patients to try to help them help themselves before I need to quote unquote help them.
I love that. That's one of the best things that you can do, honestly, or the person can do for themselves is avoid putting in chemicals into their bodies and finding ways that are natural, that are available through discipline, through lifestyle changes, which is why I'm really excited for us to have this conversation. So, you grew up around Orange County. You grew up here, which is, by the way, where our university is also located. So, apart from the online stuff, it's actually in OC. So, we love OC. It's a great place to be. What influenced you so much in that environment that led you to want to pursue this kind of medicine?
Yeah, I think growing up, I'm Indian, so I grew up with a lot of, if somebody's sick or if you have like an ailment, we don't go straight to pills. We're always looking like at herbs or say, why don't you give it a little more time? So I kind of had that belief even from a kid. And then as I saw and I went through medical school and through my residency, I saw how much we rely on pills immediately. It's like, oh, you got a problem? Take a pill. And so I started to wonder, like, is my entire job description just to prescribe pills? And I said, and I didn't go through all the school just to be sending out pills. So I started to realize that anything that can help a patient is considered medicine. So then I started to think outside the box, and I'm never against medicine or pills, but they'll always be there. So might as well try something else. If that doesn't work, we always have, medication to fall back.
That's such a brilliant revelation that I don't think a lot of people have. You mentioned your Indian background. What is something that you've inherited from your Indian background that you're like, this is something I learned from my grandma and I saw her do it, or my grandfather, my family members that really stood out to you, that
Yeah,
kept you going in all of this?
I mean, a lot of it was that, like, the way they react to something, right? If I'm sick or if I even, have a cough, it's not like, okay, let's panic, let's call a doctor. It was really just, wait, why do you have it? What else can we do at this moment in our house with what we have? And because of that, and then, the eating, right? My parents, I think, eat pretty healthy. Because of that, I got a chance to eat healthy, which I'm grateful for. And so now I try to educate my patients on just not maybe changing what you eat, just trying to monitor kind of how much you eat and when to eat. So that was kind of the influence.
I love family influence. It's always so beautiful, especially with Indian families. You have such a family dynamic where everyone is there and it's like a support system. It's amazing to see, and it's amazing to witness to this beauty. Why do you think a lot of people in the Western world go directly to pills?
Yeah, that's a great question. Why do we go? That's a a lot of reasons. I think number one, obviously, back in the day, we've kind of designed our medical model to be like, hey, you got a problem, you have a symptom, take this, take this. That doesn't work. Wait a little bit, take this. We've also kind of encouraged it, basically, right? Besides I want to say New Zealand, we're the only country in the world that can advertise medicine directly to patients. So no other country really can, like you said, if you look on a magazine, they got medicine on the magazine, on an advertisement, on the radio. No other country really allows that besides America and the US. So advertising purposes, the more you see it, the more you're exposed to it, obviously the more likely you're going to lean towards that as step one versus think, what else can I do in my power?
And to the American society that it chose to advertise, like you're saying the US and maybe Switzerland do that. Why does the rest of the world understand that this shouldn't be done, in your opinion, or from your
Well,
perspective?
I think just from my opinion, I think it's because we obviously don't try not to monetize health per se, but health is an industry at the end of the day, and they're realizing just how much detriment can come from advertising. Because then you get patients that have no problems. Say, oh, I saw this on TV. I want to try it out. Or like, ask your doctor if you have X, Y, and Z. So they're like the pharmaceuticals are almost coaching people to be like, hey, if you have any of this, maybe you got this disease, talk to your doctor, right? So I think I'm sure there's all types of reasons why it's developed this way, but at this moment, I think the original idea was just to treat symptoms versus actually treat the root cause of it.
I think you're onto something very important. The psychology of advertising and the way it's built to sell. It's a very interesting concept. I think it kind of like goes hand in hand with what's going on with or as historically what happened with the different mentality revolutions that went through the United States that led it to this point. It's quite scary, but and it also causes a lot of anxiety, I feel. So when people see these ads, they get anxious over the things that they have. How much of your work has been breaking down that mentality and to replace it with something else?
That's probably 90% of my job is really because, who cares what I say? Who cares if I say change this? It's really what do you hear when I'm talking or explaining something? What will motivate you to want to help yourselves? I can tell you 20 times, you might get a heart attack, you might get diabetes, might not be able to use your knees or be able to walk. And those are all valid reasons to do X, Y, and Z, but why would you want to do it? So I think it's a big part of my practice, and I think in general, just how finding a person's why, how to meet them where they're at versus I'm trying to be practical. I don't give them 20 homework assignments. They're not going to do it. I wouldn't want to do it. So what's something that's simple, practical that we can build on?
It's extremely interesting is that when you're saying, okay, so 95% is debunking these myths that are happening around us. What is it about the having a pill there that you can say, well, it's easier for me to take that pill rather than to worry about diabetes? So I feel like the mentality is, oh, you're going to get diabetes, you're going to get cholesterol, you're going to get this, you're going to get that. And the response internalized is, well, they made a medicine for that. So why should I be disciplined? Now, I know that within the Indian culture, there's a lot of discipline that happens, not just from parents to children, but also within the grander society. How has that played into your personal choices, and how do you think that would influence others to say, choose discipline rather than choosing the pill?
Yeah, that's great, right? It's discipline does really differentiate. Really, I think just in life, success versus failure. People who are successful aren't usually not in a better position per se than somebody who's maybe inclined to be, failed. And I tell patients the same thing. It's like, don't change anything. Eat what you want, live like however you want, take 20 pills if that's really what you want. And a lot of times they're like, no, I don't want. So I try to explain like there's side effects of pills because a lot of patients will say, I don't want to take this. I saw online it can cause this. I saw from my friend they take this pill it's causing. So I say you can have side effects from the pills or you can have side effects of unhealthy living. So you kind of have to decide which side effects you want to live with because both of them, but I said the only difference is with the side effects of unhealthy living, that's something that you had a chance to change. And so that's like, I'm like, the thing is, a lot of time with these concerns, diabetes, cholesterol, they don't feel it. What you don't feel or you don't see, it's a lot harder to understand. So that's also a big part of my education. Is how do I make them understand what they may not see or feel?
That's a great point to hit on. If you had a patient well, not a patient, someone who's in their 20s, maybe a little bit 20s, 30s, they're walking in, they're having this conversation with you, and you want to enact preventative care. And that's like a good 40 years into the future, hopefully, right? It could be less, it could be more, but let's say it's 40 years into the future and they can't see that far. What would you do, or what would you say to them to tell them, no, actually, this is closer than you think, and the things that you're doing today will affect tomorrow?
Well, that's what I tell them. Like, yeah, it's great because that's what I tell them. I say, don't change anything. Live your life. Do whatever you want. Who cares? But don't come back in 20 years and then start to wonder why your body's going to shut down, why all of a sudden everything you were doing previously is no longer working. Like, you got to take some responsibility. And I tell them, I say, sometimes if they're very like unhealthy at a young age, you have a chronological age. So I tell you, like, yo, your date of birth says you're 30 years old. Your blood work is showing you're 40. So who cares about what your age you are? Your blood work is showing you're aging faster. So I tell them by the time you're 40, you're probably going to be like 55. It doesn't keep trajectory. It gets faster as you get older, technically. All right. So that's why you say like one dog year is what they say worth like what 7 human years or something. So the idea is with patients, I say, well, you're technically, and I try to make a graph like this is normal aging. You're kind of physically aging faster. So that is like a visual way sometimes that makes them realize what can
That
happen.
actually it hits very hard if someone would tell you, oh, actually, you're 40 or 45 in your blood work. It's how do you know is the question. Like when patients come to you and they do the blood work and the results are there, the question usually is, well, how do you know that? What is it about my life that is showing you that data?
Right. So that's the whole point, right? So we look at their overall life, we look at their health, we look at their numbers. Of course, I don't usually like to treat numbers. I treat the patient, but I cannot neglect the numbers, right? If they're high blood pressure, diabetes, if you got high cholesterol, you're kind of like, well, you're fine. These are chronic illnesses for a reason. They're chronic. They don't happen now. They happen chronically later on in life. So I try to tell them, I don't have a magic ball, right? If I did, I probably wouldn't be a doctor, but I tell them based on your numbers and your habits. I say you're eating poorly, you're drinking alcohol, you're sleeping poorly, you're highly stressed, and you're not doing anything. So if you don't do something, don't expect something to happen. And so I tell them, I don't have a clear ball, but this is based on your numbers and based on my own experience. Because I mentioned that the numbers, they might be older than their age, but I have people who are younger than their age as well. So I tell them, it's like, you don't have to be your age. You can go either way. And that does come partially on me, but mainly on the patient. So another part of my job is kind of tell them, I tell them I'm not responsible for your health. Like, I am not your mom. I'm not your spouse. You are responsible at the end of the day. So I kind of put it on them.
True. It's accountability, I think, in the US is it's a little bit harder to take. I think we've been in a society where it's easy to let go of your own accountability and blame someone else, and
Hmm.
it's like there's always a scapegoat. So I love that there's a bit more of an accountability there. Okay, so what can people do? How can they change their life? Where do we start? It's so overwhelming. What happens?
Yeah, what a time to live in, right? Social media, everybody's telling you to do every single thing, change this, and they'll cure you of this. But then if you change that, make sure you change this, and it'll cure you of this. But then if you don't do this, it'll cause this. It's crazy. So number one, be realistic. I never tell my patients go home and eat rice cakes. It just doesn't work. So people have to be realistic. I tell them number one thing is why. Who cares? Live your life. Like I said, why? Why do you even care to change? Why do you want to? I even ask them, say, why do you even see me? Do you just see me so you can do 3 months of blood work and then go about your life and then get reminded in 3 months when I talk to you for like 20 minutes? Is that what your goal is? Is there something else like you want to accomplish from our visit? Because I say, if you just want to see me for just seeing me, and then they apologize sometimes. They say, I'm sorry, we're eating well. I say, number one thing, I say, why do you want to help yourself if that's the case? Simplest thing I look at is what's in your power. So diet, exercise, sleep, and stress. +1 and -1. That's kind of the rule I like to use. +1 extra, maybe +10, +1 to 10. +10 minutes of extra sleep, -10 minutes of screen time. +10 extra minutes of exercise, -10 minutes of sitting. So you just do like a plus and minus. Or if you eat like a big portion, right? Half portion. And then you want to do repetition. So those are hopefully simple things that people can do. I tell them do one good thing once a week. Just one habit and see how you do.
Behavioral change takes time, honestly, and there are so many things that happen in this life. Can you give me like a case example? If I tell you, okay, well, this is a 30-year-old man and he has high cholesterol and he's coming to visit you, what would you tell that man to change? Or what are some like practical advice that we would give him?
Yeah, so let's say a young guy maybe doesn't have any meds or whatever. So first and foremost, diet. What do you eat? Let's say he eats a lot of red meat. I have patients who eat red meat almost every meal. I just had it last week. He eats red meat probably twice a day, and his uric acid is high, which is a concern for gout, which can be very painful, cause inflammation in the joint. So I said, look, I'm not even telling you to stop eating meat. Your best bet is to just skip a meal. That's it. Just maybe cut down. If you're gonna eat this much meat, right? There's like different hand portions you can do of meat. So that's one. Um, and then if that's hard, I say maybe just alternate. Don't eat red meat, switch it out for white meat. And then if you're able to, no meat. And then take a break. So that's one. And then another way, let's say they have a hard time. Let's say they snack a lot or they have a hard time controlling their portions. I say drink warm water before you sit down and eat. Like chug like 2 glasses of water so your stomach gets physically full. So you will not have to be able to eat something like more.
I love that.
So,
That's such a practical advice. Anything
mhm.
else that's, if you were to, he gave you like full permission to reset his entire diet, what would you recommend that he eats? What would you recommend? How often? How much exercise? So that he doesn't get to that 60 years old and everything is failing in him.
Yeah, absolutely. I mean, if he's really just like, I'm ready to do whatever it takes, then we
Yeah.
definitely do deep dive. Like we said, food, portion size, cholesterol. We're looking like at meats, cheese. Also, you try to cut down. Eggs are like a safe or healthy cholesterol, I believe. And then, so that's one exercise. Instead of carving out, I also have to be realistic. So instead of saying go exercise for 30 minutes a day and people got lives to live. So I have a personal trainer. He does what they call exercise snacks. So for example, he'll cut his vegetables when he's making his dinner. So he cut his vegetables, he'll stop, he'll do 10 push-ups, wash his hands, and then saute the vegetables. While he's sauteing the vegetables, he'll do 10 squats and then go about it. So he's doing little snack size exercise. Doesn't have to be all that one big chunk. So I kind
Have
of do that
you tried
myself right now.
implement, have you tried
Kind of do
implementing?
that. Yeah.
How has it been?
It's hard. I'm not a snacker, so clearly I don't snack with food, and I'm not an exercise snacker. I'm more like set a time to exercise, but it's a great way to empower patients to say like, hey, you don't have to wait 30 minutes after you're done with your day to go to the gym to go and do this. Just 5 minutes, stop what you're doing, stand. Another simple thing I say is after you eat, stand or walk. Do not sit.
Interesting. Why?
Yeah. Digestion. Obviously, after you eat, you can sometimes improve digestion just from walking. Your muscles can take blood sugar right out of the bloodstream after you eat, so your insulin levels can sometimes lower versus you just sitting down after a big meal.
Wow, that's actually
So
very cool. You know what I
yeah.
love doing? I have an under the desk treadmill
Okay.
that it's these are like it's probably one of my favorite things, except I will tell you this, I used to go to the gym 6 days a week. Um, I as a result of this, I am not. So then this is a bad thing. It's great in that now I like walk for an hour and a half to 2 hours while working. But the while working part is that you're no longer focusing on the walking part, which is like I'm so exhausted, and you just do your work and it's there. But it's good in that it does that, but it's bad in that it stopped me from going to the gym 6 times a week. So I got to get
It's
back on that.
something. Yeah, I think a lot of walking is good. The problem is we have also catered, like even the medical society is now catering exercise to walking because that's all it seems people are willing to do. And I'm like, you got to use your muscles because I see a lot of geriatrics and like it's tough. If you don't use it, you will lose it. And people like my biggest concern and my patients too, they tell me like I'm afraid to fall. I don't feel strong to walk. I'm like, yeah, you got to use your body pretty much.
Yeah, no, it's crazy. I'm 32, and I feel like I need to stretch all the time now. I'm like, when did this is as a result of me not going to the gym every day. But I'm like, when did this start to happen? Who is this? What is this? What's changing? But even at early ages, you start to feel the like, okay, well, there's something that's there. Okay, so I want to switch a little bit, and I want to ask you, what is your favorite area of medicine that you can talk about for hours?
Ah, that's great. I mean, I like to educate in general. I actually have social media now, so like stuff I talk to you about like practical stuff, I educate. I like educating about I think this type of stuff, like holistic and more spirituality and more mental things as well, like how to also help ourselves mentally, spiritually. I think we've come to a place, I think, in society where physically we're pretty much okay. We got food delivered, we got our everything on DoorDash, but like we're having spiritual issue and emotional. We're not managing our stress, and stress is very powerful if obviously you don't take care of it.
Oh yeah. So how would you take care of stress?
Same thing. It's one of those things. I tell my patients, you can stress, who cares? Bury your stress, ignore it, just neglect it, and then it will find its way out. So I'd say either you find your stress out or your stress will find its way out. And usually when the stress finds its way out, it's usually in unhealthy ways. Anxiety, heart palpitations. Sometimes I even wonder this might be a stretch, but sometimes some people have significant ailments, cancers, severe joint pains, and I can't help but wonder like, is your stress manifesting itself because you did not listen to your body or your mind? Now it has to show you in this different way.
How important is the mind?
Incredible. Your mind is very powerful. Our body is the unconscious mind. So there's very little difference between our body and the mind. So, our minds are very smart and lazy. So they say, well, if your brain doesn't want to deal with the stress, where does it dump it? In the body.
I love that. What would be the holistic approach to changing your mindset and then to changing your body, or which one comes first?
I would say the mind, honestly, because the mind, if you think negatively enough, your body has no choice but to absorb it. And if you think a certain outcome, you will create it to some degree. They say, oh, I always knew I was going to get this. I always knew this was going to happen, right? You thought about it enough, it's kind of you've manifested it. And so I think the mind is powerful, but of course, how is always the question my patients have. You know, the most, I don't know if it's practical, but the simplest thing I tell them is to sit down and stare at a wall for 5 minutes and do nothing. No phone, no TV, no distraction. Stare at a wall and do nothing. And
What
that's
does
it.
that do?
It lets your mind decompress. I think when we talk about food, a lot of us eat like very, not the best diet. We overeat. We're overfeeding our body, but now we're overfeeding our minds. So imagine a water balloon. When you pour water in it, the balloon gets bigger and bigger. Your brain is like a water balloon. The tap is like social media, TV, radio, YouTube, text message, email, phone call. And you're on LinkedIn, you got all different places you're getting all this info. The water balloon just fills, 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 fills. We never stop the tap and we never squeeze the water out. So what's happening in your brain is you're just pumping material and content and data 24/7. We never just sit there and let it come out.
Interesting. I like that. It really is overstimulated often. And I think there's this tendency to just pick up the phone anytime we feel like there's a need, whatever it is. You're like, okay, I have a minute. I will grab my phone.
Mhm.
And I find that there's always a desire to do the good things. So, like, you know what is right, but you don't end up doing what is right. So, like, right in front of me, I'm just right there is that treadmill that I was talking about earlier. And I'm like, I should probably hang up here and go work over there. But right in front of me is also the sofa where I could sit there and work on my laptop, right? Or my desk and I could sit there and work on my laptop. When our society is faced with so much overstimulation from everything that's around it, how could it silence, as you were saying, and then within that silence be able to make the right choices?
Yeah, so that is the point. That within the silence, hopefully you'll find your answer. Because a lot of times we use distractions to avoid looking inside, right? And it's hard sometimes to look inside people's lives. Everybody goes through things. So if either we know about looking inside or we're avoiding the situation, or we just never have even taken a chance to give ourselves to look inside. And so for me, with the silence, it's not really about asking the right questions in the silence. It's just being comfortable with the uncomfortable of that actual technique, because you're going to observe your actual raw thoughts. And some people are not comfortable like what actually comes out. That's why they watch TV or even drink or go out, meet people, whatever. So it's trying to face your own reality. I tell patients at the end of the day, you choose every decision you make, whether you're conscious or unconscious. If you decide, oh, I'm too weak, I'm too tired, I can't sit on the treadmill, I'm gonna go on the sofa, it's just too hard. You have actively chosen to make that decision. And that is a lot because people really feel like, oh, it's not in my power. I'm just like this. This is how I am. How many times have you heard those things? I'm just like this. I just am like this. I've been doing this forever. You're choosing to remain in that thought process or choosing to continue with that same habits.
Very true, but I also find that, like in the case of the example I just gave, because I'm looking right, literally the treadmill is right there, the sofa's right there. I'm looking at it and I'm like, well, you know what? I think there's like an overwhelming feeling
Hmm.
of getting in there and setting up, and almost these psychological factors that would be a stop to it. So I think there's a substantial amount of people that really want to choose what is right, but there is almost like a psychological barrier that is there. I feel like if
I
once
agree. Yeah, I'm sorry. Yeah, I agree. I think a lot of that we kind of expect ourselves for a certain outcome from what we're going to change. If I start to work out or I start to use a sofa, I expect to drop weight or get better. It's like, well, don't do it for the end point, right? It's like don't expect, allow yourself to fail. Allow yourself to make that mistake. So that book Atomic Habits, it's a pretty good book. It's just basically making small changes. So in the book he basically mentions you're going to gym, right? It's hard. Let's say you got to wake up early, you got to drive. Forget all those steps. Just get up and put on your clothes. That's it. Just put on your gym clothes. And then see from there, like, okay, I have my gym clothes on. Okay, now I'm too lazy to drive, or I don't want to drive. Or you may say, oh, I have my gym clothes on. Now I might feel more motivated to drive. So it's just small patterns. Like if you're going to have a hard time with food, you put out, I don't know, you eat a big portion. You made a mistake this time. Next time, you still put out a big portion and see if you can take out just a little bit and how you feel. So it is hard. I agree. It's not easy thing to be like, hey, just choose to feel this way and you'll be better. But those are certain strategies that I feel can be useful.
I found scheduling time ahead in a consistent way. So, like, one thing that I was telling you, like the 6 days a week, the way I made that happen is I would go to church very early in the morning, and then I would go to the gym right after. And then I would come and I would go and do my work the rest of my day. So by 9 o'clock or by 9:30, I've done what I've wanted to do. Now I go about and do what I need, the rest of my day. And the other thing is, like, let's say, like, let the treadmill example that I would give. It's like, okay, well, now it's 1 o'clock or 1:30 or whatever. Now at 1:30 to 3, this is what I do. This is where I do my work. And then you set up that desk and you keep it like that. And I think those are powerful strategies. Is there anything that you've experimented with in your life that pushed you further?
Yeah, I think it's hard. I'm a pretty disciplined person, so I like to challenge myself. A lot of it is the silence thing has helped me. I journal. I think waking up at the same time is hard for me, but it's like even my alarm. It's like instead of 5:10 or something, I'll put like 5:09. Then I'll put 5:08. You see, even I do it slowly. Like, oh, I'll do 5:05. So for me, I think creating the habits or creating a checklist or something. So I think a calendar can help sometimes where you mark every day you did a good habit or the day. So you can visually see it. Just one thing that you want to change, and it doesn't have to be something drastic. And I think changes should come in like bite-sized snacks. Change something that only takes a minute to make that adjustment.
It's funny when you said that, you've been to the movie theaters where they sell those like little bite-sized ice cream,
Yeah,
the
yeah.
containers. As
Well,
soon as you said that, you're like bite-sized snack. That's the image that showed up in my head. I'm like, hmm, interesting. That's an interesting one. All right. With that, Dr. Patel, what else would you recommend for people? So we talked a little bit about dieting. We talked about mental health or mindsets and changes and things like that. What is part of the holistic approach that we haven't talked about yet, that
uh,
people often miss?
there's a lot of stuff, right? Holistic wise that we can try. We haven't gone into, of course, exercise, diet, fasting is a big one. Red light therapy, acupuncture, sound therapy. I'm learning a lot about frequency medicine. So there's a lot of, and light therapy too, which is kind of the red light. So those are just things to utilize the power of nature almost to what we can do. But like I said, sleep, stress, diet, and exercise are the top four pillars, I think, of health that mostly people have control over to some degree.
Can we talk about
So,
sleep?
yeah.
I feel like
Sleep,
sleep.
yeah, that's a tough one too. Yeah.
Yeah, like how do you get enough hours? They say like 8 hours, 9 hours, whatever. And most people are getting 6, maybe 5:30 at most. What do we do? How
Yeah,
do we
that's a
fix
tricky
it?
one. Sleep is tricky. I struggle with sleep from time to time myself. I'll sleep good a few days. It's just, it really comes down to your sleep hygiene, which is, do you look at your phone? Do you, whatever? Do you go online before you go to sleep? It's very complex. So this is where we get into what strategies. Also, the way you eat. If you eat a heavy meal at night versus a light meal, does that affect your circadian rhythm? Stress. So sleep first and foremost. We look at same thing. What's in your control? Sleep. So stress, diet. You fix that, great. Then we look into your habits. How do you sleep? Which way is your bed? Is your, so there's so many different portions. But the
Wait, hold
biggest thing,
on, back up. What's with the orientation of the bed?
sometimes if you sleep on the side, you might get neck pain the way your shoulder is. I've had patients injure themselves in their sleep from
Yeah, yeah.
neck pain, back pain, shoulder pain, you name it.
That makes sense. I thought you were talking about like the way the bed is set up. Like, is it facing? Like,
There's
wait,
some,
what? Whew, okay.
they have that. I'm not that into that, but I'm sure that plays a role, like feng shui and all of that. Like the way if your head faces west versus east versus north, there are different like I think beliefs and different structure that can affect you. I don't know too much about that per se. But I do think in sleep hygiene, right? Looking at your phone, keeping it cool, keeping your bed cool. Obviously, you want your bed to be comfortable. Those things obviously do play a role.
So what would you recommend that people would go into? Do they
First
replace the
is
light bulb, for example? Like, should I change my yellow light bulb into a red light bulb? What is it?
right. So gold light, yeah, it's like a warm lighting. Number one, no screen time, probably 30 to 40 minutes before you sleep. Then you want to do something that's de like squeezing out the water in your balloon. So either you're doing something active, either like you're maybe, I guess reading is kind of passive, but that still stimulates your imagination. But that's when you want to get stuff out of your mind. So either you journal, or if you need to just reflect on what you need to do, make a list. So the whole goal is not to keep it in your mind, is to get it out on paper or a physical way. So that's one. I know some people say that exercising may help, stretching, something to loosen up the body too, because our bodies obviously hold a lot of tension. So it's 5 minutes. And then of course there's like smells. You can do aromatherapy, chamomile tea. There's all different types of things to give you the best fighting chance to sleep.
What would you mind sharing your sleep hygiene routine?
Yeah, let's see, I try not to look at the phone at least in 35 minutes before. I will brush my teeth. Sometimes I
How do you
walk.
accomplish that?
Sorry?
Sorry. How do you accomplish that? So the 30, 40 minutes, because it's a struggle for most people. So
It
what do
is.
you do personally that's like, okay, well,
I put my phone in the other room. Right, so
mhm.
that's one. My phone's not on, it's on do not disturb. So only the, important people who can call me will. And then I don't, and that's it. I just put it away. Physically, I leave it away from my bed or my living room. And that's it. If I gotta go back in 10 minutes, that's fine. It is like you're training. So you don't have to do 30 minutes. You can do 5 minutes away from it. You can
Yeah.
do 10 minutes, right? So it's like you gotta keep training. So once I put it away, then I'm like, all right, sometimes I'll just relax, I'll read, I'll journal, and then I try to end the night just staring into space or just zoning out for like 10 minutes. Whatever comes to my mind, but just let myself decompress. And then you can use like incense, you can use candles, something to set kind of the mood or the scent.
That's a brilliant idea. Hopefully people can actually implement some of these things and fix their sleep cycles. Is there a certain amount of hours that you're like, you have to get this? This is your baseline. Or is it by age?
It's a lot of all these new technology. We got wearables, and they say, "Oh, I'm not tracking." I really, yeah, yeah, yeah. It really comes down to they recommend 7 to 8 hours, which is a lot sometimes. Like I was thinking myself, if I oversleep, I get tired. So a lot of it is how restful is your sleep. But a general rule of thumb is I would say at least 6 hours if possible. 6 to 7 is realistic. Sometimes obviously they say 7 to 8. And it's like, do you feel tired? Do you feel rested after sleep? That's also a big question.
You know what I've been trying? I don't know if this is actually scientific or not, but you know how like your rhythm goes like it's usually in like 90-minute cycles.
Hmm.
Whenever I have to wake up like extremely early and I have to sleep later at night, I do the calculations of what do I have? What's the time frames? Like, let's say I have to sleep at like 2 in the morning and then I have to be up by 7. Okay, so how many 90 minutes are there? And I'll set the alarm from whatever, 10 minutes to take me to fall asleep. So I'll count for that. And then I'll add the however many cycles I could fit in and try to wake up at the end of that cycle. So that's been don't know how much it works, but it was worth a try.
Worth a try, yeah. I think so. Even intention setting, right? Just telling yourself, like, I am going to sleep well tonight and I'm going to wake up. Like, the mind is powerful. I think people we underestimate what we can really accomplish if we just think it out. Yeah.
No, seriously, it's so important. Okay, so I want us to end our conversation on something like a humorous note. I feel like there's a lot of things that have happened in your life that are just like very comedic. Not because I feel like you take things very lightly as well. Like it's a beautiful soul. Um, can you think of a medical case that you've encountered that made you laugh? That
There's been quite a few. I think it's like, let's see. I had a patient with a lot of stomach pain. And I was like, what's going on? He's like, I get gassy. We went through everything. And then I said, do you, any more cheese? No. Do you drink more? No. So what's going on? So he said, he started eating more Otter Pops, those popsicle, the frozen icicles or whatever. And we were like, we went through all this blood work. I was like, what's going on? He's like, I get diarrhea. I'm having these issues. You haven't really changed your diet. And he said, Otter Pops. He changed that. He stopped it. Everything resolved.
That's insane. It's the power of one thing. Have you had nutritional yeast before?
Nutritional yeast, have I had it I don't know if I've had that per se, no. But I know some of my patients cook, I think, their bread or something with all that
There's a
stuff.
lot of like I from what I hear, there's a lot of really nutrients in
Hmm.
it's very nutrient dense, but
Hmm.
it also changes the urine color to like a fluorescent thing, like a
Ah,
fluorescent color. And so anytime I cook with it and I'm like feeding somebody, like I'm like, hey, by the way, don't freak out. If you go to
yeah.
the restroom, this is what's gonna happen. So a lot of times it's something like that. It's like freaking like what is this? What's wrong with me?
Yeah,
So
I'll tell you one more story real quick. So I had a patient with an inhaler, right? So like, you push it,
yeah.
inhale it. So I prescribed it to her, thinking like, they knew. She's like, she calls me. She's like, I don't feel better after a week. I said, come in, bring your inhaler. I was like, show me how you do your inhaler. So she sprayed it like this, like perfume. I said, it works when you inhale it. So the whole point is, yes, it's always good to troubleshoot.
It's in the word. It's in the name. You
Exactly,
inhale.
inhaler. But I don't think she thought she was spraying like cologne. I was like, this is not how it
That's so
works.
funny. That's so
Yeah,
funny. I love that.
yeah.
All right. With that, I want to ask you, you're now on social media. Yay, congratulations. How can people find you? Where are you located? What's the handle? How can they connect with you? And where is your clinic also? What's the name of the clinic that you're at?
Yeah, absolutely. So my clinic is called Phantom Medical, but you can just type up my name, Neil, Neal H. Patel. Should show up. I'm in Orange County, city of Orange. If you want to follow me I'm on all social media platforms. I'm on TikTok, LinkedIn, Facebook, YouTube, and Instagram. And my handle is at Doctor, so Dr. and then Neal. So Neil H. Patel. So all one word, Dr. Neil H. Patel, all one word, and you can follow me. I talk about all this stuff like, because I'm like, people I think are looking for something they can do now. So I said it can help my
Mhm.
patients. I think it could help people in general. So might as well give it a shot.
Hey, you're doing great. That's amazing. What would you like to leave our audience with? One thing that they're like, hey, this is great.
I think people in the audience, my entire goal is never to lecture my patients and like make them feel that they're not able. I want to empower them and let them know you have a lot of power in yourself. Give yourself a chance, and I cannot prescribe time and I cannot prescribe patience. So be patient with yourself because everybody wants it now. I want to feel better now. I want to get better now. I want to be happy now. It doesn't always work like that. So be nice to yourself and give yourself a fighting chance.
But we gotta put in the effort, guys. We gotta put in the effort. Otherwise, we don't get there. Dr. Neil, thank you so much for being here with me. As for me, I'm again Rita Sekali. You could find me at The Word with Rita. And as for KPU or Kairos Pacific University, it's at KPU_California. And we have incredible programs, you guys. You really have to check it out. Particularly, we have an entire campaign running on Be a Healer. That is what we want people to become when they join our programs, our counseling programs, and of course, leadership, pastors, anyone in a leadership position. The programs are for you and for you to grow as well. Bachelor's, master's, PhDs, we got it. And if you have any questions, you could always find us at our website at Kairos Pacific University. And until then, I will be with you guys. I hope you have a great time. I'll be with you in the next episode.